why do you want to study medicine?
Well, I've always been interested in science, and in school it was particularly my human biology classes that I found really interesting. And so initially I looked at a number of options within that field, but I felt that medicine combined both the application of science with the provision for caring for people in sometimes the most difficult times in their life, which I feel personally is a privilege. And also, I think that medicine as a career is, ever evolving and is very, very dynamic. And there's lots of room personally for self growth and for learning and development. And so I think that suits my nature perfectly.
So you mentioned a little bit about your nature there. What is it about yourself that makes you think you'd be a good candidate for studying medicine?
Well, I think I've got great communication skills, and I've been able to develop those through my volunteering, working with children at a summer camp with additional needs. And sometimes those children would struggle to communicate for themselves, so I'd have to think out the box and come up with alternative approaches in doing so, which I think very importantly links to medicine, because as a doctor you have to be able to communicate with patients even when the patients themselves might struggle. Also, I believe I'm a good team member, and I've played basketball as part of my school team for several years. And as a team, we have to be able to communicate and know everyone's strengths and abilities and work together, which is very important when working as a multidisciplinary team in medicine. As well, I think I'm quite a resilient person, and I can cope with stress well, and I'm quite level-headed. And again, I think that's so important when you're working in a busy ward environment at a hospital.
So why do you want to study at this university?
Well, the university, as you know, has a great reputation, and particularly the medical school, in terms of student satisfaction and preparedness to practice. And the curriculum allows topics to be revisited in more depth, and allows the students to build both their confidence and their knowledge. Also, I really like that here the students have patient contact from year one, and also that the anatomy teaching uses dissection, which I've heard is a really great way to learn. Also, the university is involved in some forefront research into cardiovascular disease, which is something I'd be very much interested in and learning more about, perhaps if I were to do an intercalated degree.